Namaste dosto. Today we will be seeing the burnout especially in our younger doctors. And we did our practice in the beginning. We hardly knew anything about burnout. We did actually have a lot many patients, and our working hours were more, and the facilities were limited. At the same time, the expectations from the patients were also equally realistic. But the days are changing now. The younger generation, which is being subjected to the different scenario, the patients are changing, their expectations are changing. Many a times the expectations from the patients are unrealistic, and the medical legal complications are increasing. So this leads to a lot of pressure, and also further the younger doctors are supposed to document what all they do properly. This is the one more added work which is put on the younger generation. Our younger generations are definitely smart, but they are getting this burnout very early in their medical practice. And this burnout is not because of the patient load. Definitely, the younger generation, the number of patients they are getting compared to us when we started the practice is less, because there are a lot of competition, and so many doctors are coming out, and naturally the patient load is less, but still they are getting into this burnout. This is basically changing patient behavior and changing patient expectations, the changing the information that is being passed across the patients. Now we are in the age of AI, and the medical legality is increased now. With these two things in place, the younger doctors will be subjected to higher stress, and they can get burnout very easily. The one thing that has not changed here is the tools which we used to do practice. Our younger generations are continuing to use that only. The changing times needs to have a different set of tools. Our younger generation, or ourselves also, have got to change with times, and we are supposed to document what all we do more properly. Unless it is done, the complications that we may face could be tremendous. Imagine the patient these days can easily have an access to the artificial intelligence like the bots like ChatGPT, Gemini, Claude, many are there. They can upload the prescription and find out the ifs and buts and what probably it can cause, and what has been missed. Anything it can, because all the reports they will have, and they will discuss and come back to us. And like in few years back, when we said we will not entertain the Google enriched long knowledge people asking to us, that is not possible these days, because the AI would have given the answer which is nearly accurate, and it can challenge your opinion. So we will have to be very careful when the patient has come to us with AI generated information, and if we ask, we have to be double careful in answering that, or else we may get into a trouble. Now, why this is more problematic in Indian setup? See, in Indian setup, the most of the hospitals still depend on the paperwork for documentation of the patient's history, diagnosis, or discharge summaries, whatever, all of that. But this is a very inefficient system. If you use these tools, and if you're fighting the AI from the patient side, definitely you are going to be in a place where you're not able to competent. So you need to also be using AI in your medical practice to combat the head-to-head what the patients are expecting. So you need to embrace the EMR. I do agree the doctors don't like EMR. We know very well that, but the age of AI, EMR can also be simplified. See, you need not have a complex user interface where the so many inboxes are there. Go and fill this number there, wait here, that here, that here. That will not be the way the AI powered EMRs will be. They will be very simple. like if you are the way you use chat gpt, the interface, you can see very simple, one text box is there, you need to either speak or type and the job is done. Similarly, the AI powered HIMS like ours, I'm speaking nice HMS, where there is one box where you can fill it with much of the using the AI power, and the job is done with a simple text commands. So thus it will give you a more accurate output, and your work will reduce. Further, you can delegate your work to your subordinates, and thus your burnout also will come down because they are using AI. So the whatever the data entry job which can be automated, that can easily done when AI powered it is. So that's the one way you can reduce the burnout. So I will give you further one more example what happened, how the patient's behavior is changing and why we should also change accordingly. One of my relative who had a malignancy, and she took 6 cycles of chemotherapy, and after the surgery somehow doctor said you need one more 6 cycles of chemotherapy, and the son of the patient, he's a techie, he just took all the documents, put it in the chat gpt and also perplexity, where all he could, he put it all the documents, then he started asking questions. Then he would know that the total number of cycles need not be more than some 12 or 18 something, that is an upper limit, and there is no benefit, something like that. It was giving a report now. Actually what had happened is the doctor who prescribed after the surgery had forgotten the number of cycles that was given pre-operatively. That was a problem. In fact, I confirmed with one from local, my own friend oncologist. He also said there is no need to give so many, 3 should be sufficient. So this sort of complications can happen if you are not using AI in your day-to-day. If the doctor had used AI, kept the documents in a EMR, he could easily access them, summarize them, and check what our patient actually requires. This complications could have been, actually complications did happen, but if unchecked, it can happen. That's it. It could have happened. That's how the AI one patient could be saved. I got plenty of such episodes which have happened in my own practice, how AI has prevented the foregoing possible complications. Other videos are there in my channel. You can always see that now. Now, one thing we have got to change. We, the doctors, are not the custodians of medical knowledge. That is a fact. So this thing, the patients have got very much access to the medical knowledge, medical literature, and the context that AI can generate will be very near to the accurate, and whenever they ask something you should be double careful to say no. That's very important, because even the Sundar Pichai, CEO of Google, has said in BBC interview that he very clearly said the patients will be able to check the prescriptions in the AI bots, what the doctor has given, what are the side effects, what are the advantages. The patients can upload them and discuss with the AI, and they can get the answers in the way they understand, and they will be better informed now. So you need to also be geared up to combat such a patients now, or else unnecessarily you may end up with the medical legal issues. This is one aspect of it. Now let me tell you how AI can, with the help of the EMR, prevent the burnout. See, the AI can generate a very simple user interface, as I told you. So this simple interface, just with the text commands, you can generate the most of the things very easily. That also I told you. There are such implementations are there in our own SIFS, that is nice HMS, where you have got, if the patient comes to the hospital, there is something called as a initial assessment. So your junior doctors just will be able to access the previous data and with a click of the button, it will give him the complete previous data in a well-structured way. Tables, what are important, what to be done, what is the patient's actual problem could be, and very fast the triage or the decision can be set, and the concerned consultant can be informed, and things can be activated from there. That is the first part of initial assessment. Another place we have implemented is generating a discharge summary. Generating discharge summary is nothing but it is the diagnostic reports and what all has been done in the hospital say that has been summarized and given. Now AI is very good at summarizing the data. With a click of the button, you can summarize what all has happened in that visit, and the discharge summary will be generated. And further, the speech of the text, the consultant or even the duty doctor can input with a speech. That speech will get mixed with the generated data, and a final discharge summary will be well written without hardly any mistakes. This even further can be improved from the consultant. He will see it and he will give the advice. Even if he is in the home, he can just discharge the patient, write the discharge summary, because the whole NICE HMS is a cloud based. You can access it anywhere. So that's how the discharge summary writing can be activated. Apart from this, there is one more thing is generation of diet. We all know that the diet prescription is somehow has taken a back seat in our medical practice, especially if you're dealing with the lifestyle diseases, what I call a lifestyle disease like diabetes, hypertension, ischemic heart disease. Somehow the prescription of diet is not complete. We just give some 1 or 2 sentences. That won't be sufficient. The actual diet for week plan, if it is given to the patient, they are more likely to follow. So many diseases can be treated with a simple diet. They may not require most expensive medicines. And the diabetes, for example, in the early stages, it may, if the patient does right amount of diet and exercise, he may forego the requirement of tablets for some years, or it may postpone for a pretty long time. And so the diet prescription can be easily generated in NICE HMS with the artificial intelligence, and in fact it can be translated to any Indian language and also given to the patient. This is one more implementation of AI in our own HIMS. Next implementation of HIMS in our HIMS is diagnostic reports, especially the radiology reports, where text-based diagnostic reports are there. Radiology reports, CT scan, ultrasound, and all. The consultant, what he does, he uses a template. In that template, he will wherever the abnormal findings have come from, that he will just modify that. Now this can be, with the help of the AI, can be automated, and further giving speech to a text. The radiologist utters the abnormal findings, it gets into there, it mixes with the template, and wherever things are to be modified, it gives the final report very easily, and with less typing, less human labor, you are able to generate the final output. Anyway, the radiologist has to see that and give it. That's how the AI is going to help us in generating the reports. Now, this is the way that AI or EMR, the usage of EMR can actually, I'm telling AI powered EMRs can actually be reducing the work and protect the doctor from medical legal complications, because you are documenting now. To protect yourself from the documentation, you need to have a robust documentation, or else the medical legal complications can increase, and it adds to the stress and adds to the complications, and also financial and so many problems can arise. So that's why I would suggest, please start using EMRs and start moving away from the paperwork. Paperwork written prescriptions and all that, they are prone to many errors. The patient will I've seen many patients. You are given a prescription today which is modified. The patient will be taking the prescription from the past. I've seen such many things still are happening like that. So these things, unless you have got a very, very well track of what you are written, well organized, even what patient is doing a mistake, you can't tell him also, because you give everything to the patient and send, and patient will forget the newest one, and he will bring you to the oldest one, and you are also confused what modification has been done and this, unless you also have a copy of prescription with you. Many times this has happened because and it has led to complications also. This has happened. So you need to have a proper copy of the medical records, which can be seen immediately with a click of the button, and that's as possible with AI. Of course, the AI can be also implemented along with the claim processing, and many things are there. That is a different ball game. Now I want to know your opinion about how AI can revolutionize the medical practice and help our younger consultants to not to get burnout or bored from the medical practice, because we know they are very smart kids. They have put their hard effort to get the medical seat and post-graduation seats, but when they come out, they find this altogether different picture. So I have got one more video in this channel where they can know how to develop medical practice, changing their mindset, how to develop the leadership skills, and how to all those tips and tricks. That one more video is there. I'll put the link in the description. Kindly go through. Thank you for today. And this is Dr. Umesh Bilgi signing off. Please do comment whatever your opinion is, and subscribe to our channel. Thank you.